Good morning, everyone. So welcome to another episode of Movement Monday. We are happy that you again woke up early to join us this morning. So I am Dr. Kaye Napalinga. I'm a developmental and behavioral pediatrician, and I will be your host for this morning. All right. So today, I am happy to introduce our speaker because she is very instrumental to the improvement of a lot of my patients, no? So our speaker for this morning is a physical therapist. She graduated from Loma Linda University with a bachelor's degree of life science, and she continued on to complete her master's degree in physical therapy back in 1993 in the same institution. And she wasn't satisfied. She went on to take her doctorate or complete her doctorate degree in physical therapy at A.T. Still University in Arizona. She is certified in neurodevelopmental treatment, and that's something to be proud of because it's hard to do. And she is also certified in sensory integration praxis test. She is a kinesiotaping practitioner. She is also certified in pediatric massage therapist and pediatric instrument assisted soft tissue mobilization. So let's all welcome Hosanna Say-Camacho. Hey, Hosanna.
Hi, Doc Kay. Thank you so much for those kind words.
All right. So our outline for this morning. So we will be talking about good posture, the true meaning of alignment, just a little bit of explanation about the spine. We'll go through bad posture, posture check. You yourselves will be checking your own postures, and some corrective exercises for you and your children. Okay, my first question for this morning. So I'd like you to help me answer this poll. Are you a happy dog or are you a sad dog this morning? Okay, let's take a look. So Hosanna, 100% happy dogs this morning. So I want you to take a close look at the happy dog and the sad dog. That's good to know. So I'll pass the mic on to you, Hosanna.
That's great news. Everybody's minding their posture this morning. So thank you again for coming and joining us in this lecture. So since we're going to talk about posture, we need to understand what the definition of posture is. So we'll start with that one. Okay, so posture is basically placing your body in the most appropriate position relative to the segment and as well as the whole body. So really, what does that mean? Posture is your most decent position of your spine that is the most efficient, okay, least energy consumption, and at the same time, you're in an adequate condition that your body is ready for action. Okay, when I say the least effort or least energy, basically when your spine is aligned, you end up depending on your inherent strength of your body to hold yourself up. And so that's why we always, what we recommend is for you to have a good alignment of your spine so that it's going to be less energy consumption on your end. Okay, and then you have to look at it, your posture really begins at the pelvis, because pelvis is the very foundation for upright posture. So you have to remember that. So once we put our pelvis in the correct alignment, then the spine will also follow. Okay, next slide.
So I mean that a for movement.
Sorry, it was kind of choppy, so I didn't got your question.
So it says on this slide, a form of fitness. Does that mean a good posture is a prerequisite for good movement?
Yes. When we talk about fitness is also meaning what you're physically fit and you're healthy. So actually to have a good posture, the muscles of your body has to needs to be able to work together to support your spine. And at the same time, once it's aligned properly, then your body will be able to move. Okay, so in order for us to have a good posture, we actually need to get to our neutral spine. Everybody has their own neutral spine. So my neutral spine is very different from yours. So basically, you need to find where that is. And again, that's where you have that relaxed uprightness. So you're upright at the same time you still feel relaxed. So when you have good posture, the muscles that surrounding your spine are balanced and they're working together to support your body.
So it's a common misconception, you know, our grandparents would tell us, tumayo ka ng dedo o stand up straight happy person or academic. So that's sort of a misconception, di ba? Because,
Yeah.
you know, go ahead.
Yes, when they say nga na diretso yung likod, the back is straight visually, but actually internally, the spine does look different.
Okay. So I've been hearing a lot of science about gravity and posture. How do you explain that?
Okay, so the body actually, the goal of the body, of the human body, is actually to come up to an upright position. So if you really think about it, when a baby is born, they can't really do anything. They're dependent on people. But as soon as they are learning how to move, the very first thing that they do is actually strengthen their muscle with the eventual goal is getting upright. So even for us, as soon as you wake up in the day, what do you first thing you want to do is I need to get up and move about, because when we're in upright position, that's when we can interact with the world. So because we need to be in upright position, what that does mean is that our body orients itself to the vertical axis of gravity. So in order for us to stay upright, we need to be able to build the framework, which is the structural integrity of our body, which is going to be our spine to keep us up all the time. So if in this slide, you look at the picture to your right, there is the plumb line, and then you see the skeleton. There's a straight line that goes from the shoulder all the way down to your feet. So all those structures, the joints, the ligaments, they all have to work together. They have to be positioned correctly so that everything will be in that straight line in order for us to keep our body upright in order for us to function.
Okay. Jose, diba, our culture nowadays is fitness, you know, muscle strengthening and everything. How, because you're saying as structural integrity, it's as you're telling me na we keep on thinking about those muscles, you know, building six-pack abs. But what's really important is the structure that holds those muscles together. Can you explain the concept?
Okay, so in our body, we actually have superficial muscle and we also have deep muscle. The superficial are more for movement and power. So those are the ones when we do weightlifting that we actually strengthen. Granted, when you do weightlifting, before you do any lifting, you have to actually set your posture in good posture before you do lifting, because if you have a bad posture, you can actually injure yourself. Okay, but in order for us to have a structurally sound, good alignment, our deep muscles are the ones that needs to work, such as the rectus abdominis is our superficial muscle, but the transverse abdominis is the deep muscle. So those deeper muscles are the ones that are considered postural muscles, and those are the inherent muscles that we depend on. That if our joints are aligned properly, then those muscles can work and help us stay upright.
Okay, so that's very interesting kasi nga yung culture ngayon mag-develop ng six-pack abs but they don't realize that there are more to that than those six-pack abs.
Yes.
So tell us more about the curvatures of the spine, why it's important that it's not really straight.
Okay. So actually our spine has those curves built into it because it actually makes it more stronger and more resilient. As soon as we're upright, there's a lot of axial compression that's being placed on it because of gravity. And with all that curve, it makes it more resistant to that compression. So then it takes the weight and cushions all those compression. So that's why we have the curves, and the way it's positioned towards one another, the plumb line goes directly almost like right in front of that spine to keep us centered. Okay, so what we need to do is actually develop the muscles around that spine, that they work together. So then, as they work together in a coordinated fashion, then we can maintain that alignment.
Wow. Kaya din important yung bone health, Hosanna, 'di ba? Because our bones really are the foundation. It's like our body is our house and those bones are our foundation.
Yeah, you're right, Doc K. So, I mean, just the spine alone, there's what, 26 bones that we're looking at that we need to take care of.
Okay, so what about poor posture? How is poor posture developed in children? I'm noticing a trend na there are more children who have bad posture nowadays as compared to back in the 50s. So what's up with that?
Okay, so how do we develop poor posture? Basically, poor posture is defined when the spine is positioned in a natural way, where the curves are being exaggerated or emphasizing, and which ends up causing problems with your joints, the muscles, the ligaments, the tendons, and they're always put on stress position. So, like in the beginning, when I said, in order for you to have good posture, it is actually a habit. Okay, you need to, in a sense, train your body to be able to do that. So, initially, you would have to be mindful of your posture for you to have good posture. So, what happens now with the children is, for one, when we have that, when they were babies, the first thing we're told is that back to sleep campaign. So once you're put to back to sleep, then it does not help develop the postural muscles that you need. So in order for us to actually develop the postural muscle, the best position when you're an infant is actually on your tummy time. They have to do plenty of tummy time in order for them to start working on the muscles in the back to actually strengthen it. And is which is the beginning, the foundational training to develop good posture.
So I guess the right approach is going to be always keen on letting your children sleep on their tummies and would recommend to let them sleep on their backs for the first 6 months. I guess, Hosanna, the point is to find that balance that when they're awake, to put in that movement also.
Yes. The human body is meant to move. So yes, we definitely want to encourage them to move. And as much as you can, even though they're still young, if you can, put them in on a mat that's on the floor, because the the gravitational forces, the ground reaction forces that you can get from the ground really helps with developing the muscles that we need for good posture. Because remember, our body orients to the vertical axis of gravity. And so in order for us to do that, we also need to learn to understand how those forces act upon our body. And so that's why if we put them always on the bed on a soft mat, then the translation of those forces is not as strong as if you had laid them on the floor on the mat while doing their tummy time or when they're playing. So we encourage the kids to actually play on the floor as much as you can.
Ang galing. What you were saying about ground reaction forces, I guess the first ground reaction force is when a newborn baby, sits on the mother's chest and starts ground reaction force itself in reaction to the mother's body, right?
Yes, yes. There's already forces that's acting upon it when they do that. And that's why even it's very calming for the babies because they get that reaction and they have that sense.
So when as a kid, I really had that. And now I'm more mindful because of you, Hosanna. You taught me that. Examples, we asked you earlier, are you a happy dog? Are you a sad dog? But there's also a tense dog. You mentioned else as the
Sorry, it's hanging on my head. So
you were saying earlier about pelvis being the base of support. So how do you explain that?
okay. So as far as minding your posture, like we were saying, the pelvis is basically the very foundation of, or it's the base of support for the spine to be in alignment. So if you look at the very first slide, the pelvis is actually tilted towards the back. So as soon as the pelvis is tilted towards the back, the spine kind of has to follow and correct itself, adjust itself so that it can still balance, because that's what the body wants to do. So now, because the pelvis is tilted backwards, then you end up having a C curve. And then you can see the one in the middle, the pelvis is now tilted to the front too much. And with that, you can see the exaggeration of the curve.
I think we got disconnected. All right, we're back. Hosanna, are you there?
Yes, I am.
Okay. So I think we're disconnected. So we were already on tense dog.
I still can't see the slide.
Teacher Hosanna, I guess while Dr. Kaye is trying to get back online, it made me wonder when you were talking about postures, like for children, are there recommended ways to improve the sitting? Would you have suggestions or recommendations? Is that a chair issue or
Yeah,
something?
one of them is the chair issue. We'll address that.
Uh-huh.
But yeah, it's really positioning the babies early on in a correct alignment. So that's why even in therapy, that's, if you notice, that's what the first thing I really work on with them is really getting that good posture, because once you get the good posture, then it's easier to function.
Yeah. About how old do you usually would you be able to work on that posture and getting them in that upright position?
Well, even as soon as they can do tummy time, that's where everything starts. I mean, a big part of it really is they don't get enough tummy time. So since they're not getting that tummy time, so then their back muscle is not that strong. So even when they start holding them up in sitting, they already have that rounded back posture. So from there, once they start learning how to sit, you really need to help them align that pelvis. And then once you can help align the pelvis, the spine will come automatically. And then you just need to train them.
Yeah, I've actually seen you work on that, and it's quite magical to see the kids straighten up.
Yeah.
Just
I mean,
working on the hips.
yes, when I focus with babies, that's the very first thing I really get from them, is to get them in that. Once I can see they're sitting up straight, then I can move forward. I mean, I think practically all the Down syndrome babies that I have, they all sit with a nice posture. I mean, I know like the staff always tells me that the kids that you work with, they always have that nice sitting posture, but that's my goal, is to get them in that. And then once they learn how to do it, it pretty much kind of carries on until when they're older again.
Yeah.
And when they start looking at, doing iPad and all that electronics.
Okay. And just in time, there's Dr. Kaye.
Okay, can you hear me?
Yes, yes, I can.
Sorry about that. I don't know what's wrong with my connection this morning. But let's move on to what causes bad posture. So I heard you mention about lack of movement early on, lack of tummy time, but as they grow older, so you mentioned television. So how would you explain that?
Okay, so there's actually a lot of reasons that can cause bad posture, and here's some that we can just cover. Okay, one of them is puberty and pain. As they get older, like for puberty, when they grow, that's a rapid growth in their body. So there are times that their body is not able to catch up to that change, and which puts them more at risk to developing poor posture. Okay, so just like girls who are developing their chest, at that point when they start having breasts, then because of that weight and they don't know how to align themselves yet, they tend to actually stand with the rounded posture. And as if they don't correct it at that time, it can just get worse, progressively worse. Okay. And then as far as pain, I think for people who've had back pain, you know what you end up doing when you have back pain. You actually end up compensating to protect that area where it's hurting. So when you have your muscle spasm, you actually go into compensatory position so that the spasm won't happen again. And if that actually persists, you can eventually develop bad posture as well. And if you see the rest of in the list, they kind of work together, or they're, it goes from one to the other, and it's just a vicious cycle, which is like the obesity, the sedentary lifestyle, the technology, the repetitive bad behavior. And we can kind of include environment there as well. So you can see if we end up choosing a sedentary lifestyle, we end up just sitting on the couch, watching, playing video games, watching TV, just having that bad posture. And then we're eating, we're not moving as much. Then we end up getting, gaining more weight, getting more obese. And then now the more sedentary you want to be because it's harder to move. And then with technology there, you're getting addicted to technology, then you're even more sedentary. And then the repetitive behavior comes in because now you're going in that bad habit and you're doing that bad habit, 4 or 5 hours a day. Next thing you know, you already have a bad posture. And the environment comes into play because now too, with the condo living, you're in this restricted space, and you don't get to go out as much. And so the movement is also limited. And so again, because you don't have that much space, you end up, okay, I'll just watch TV. Oh, my kids can just play iPad. And so now we're just going around in that vicious cycle. So another one that can cause bad posture, especially for kids, is the use of heavy bags when they go to school. So once they carry heavy bags, okay, their body has to actually adjust to the weight of the bag. And because of that they need to keep themselves upright, they're actually hunching forward to keep that heavy bag up. And so that too, if they do that every day, going to school between classes and all that, eventually they will actually develop back pain, shoulder pain, knee pain, whatever pain, and then they will develop compensation, and which would end up resulting in having bad posture. Another one would be also wearing correct shoes. If you're wearing the wrong shoes, non-supportive shoes, or for adults, those high heels, that can also help you in developing bad posture.
So, Hosanna, how do we teach everyone this morning what a good posture is, or how they can test themselves?
Okay, how we can check having good posture really is in sitting. Okay, again, our very foundation is in the pelvis. So we want to make sure that the pelvis is in that neutral position that would support the spine straight. Okay, as much as you can, you want your feet planted on the ground, feet supported, whether it's on the ground or something that you can stand on, that it's supported, so then you can give some input from the ground as well. You want to make sure that you put an equal weight on both hips. Okay, so you have to think about the men who have those thick wallets that they put on the back pocket, and then now they're sitting off to one side. So you want to make sure that they're actually seated equal weight on both sides, okay, of the hip. The back pretty much in your neutral spine position. Okay, your shoulder should be pulled back, but not exaggerated like this, but it's just pulled back in a relaxed position, and your ears is aligned with your collarbone. So that's when you see your relaxed upright position. And then for the one in standing, okay, it's pretty much the same. The only thing is now we made it taller, including the legs. So we want to make sure your feet is planted shoulder width apart, or somewhere, you know, shoulder width apart. You don't want it too wide or too close together. And then your knees, you want to be slightly bent. So if you actually look at the first picture, the knees is bent too much. And then you can see the rounded back. The one in the middle, the knees are hyperextended. And then now you can see the pelvis is tilted forward with the exaggeration of the curve on the back as well. And on the last picture, you can see that the knees are just slightly bent, and you can see how the alignment is so much better. And the shoulders will still be aligned, you know, back with and relaxed, and the ears is directly over the collarbone.
Okay, so if we mention that it's good to practice posture, what are the benefits? You mentioned about good posture. How do we, you know, practice that? You said it's practice. So how do we practice good posture?
Well, in order for us to actually develop good posture, we need to be mindful of it and really find where our neutral spine is. So you need to make sure that you know where your pelvis is, or that it's going to be comfortable for you, so that the alignment of your pelvis is in the correct space, so that the rest of the joints of your spine is aligned to the pelvis correctly, and the muscles are working together. So because there's benefits to having good posture. And basically the first one is getting that good alignment of your body. And then now your body is ready to move. At the same time, you eliminate or you decrease the potential of having back pains, joint pains, tension or stress to your tendons, to your muscles. The other thing is it will improve your breathing, because the rib cage is actually attached to your spine, and within your rib cage is actually the lungs. So one thing, if everybody can try to slouch and round your back and try to take a deep breath. And now compare to sitting up straight, finding your neutral spine, and then taking a deep breath. And you can see that you can actually take deeper and longer breaths. Are we back on?
He's not yet back. I guess, Teacher Hosanna, what you were describing really resembles what we do in yoga.
Yes.
And I think we have a few yogis in the audience, but I feel that's really part of it, right? The sitting up straight, even sitting from the floor, cross-legged. I imagine those are the positions that help you maintain that posture.
Yes, it's all the yoga position, the exercises that we're doing today.
Yeah. Oh, awesome.
Yeah. It just so happened. Yeah.
That works out for us.
Are we on, Kaye?
Yeah. What are
Here we
some
go.
that we give, some tips give our parents, we have children of different ages. So what good tips for good posture?
Okay, so the first thing actually, let's look at, since we're talking about the different ages. When a baby is born, as much as we can, if we can do tummy time, because like I said before, tummy time is the first one that they start preparing or strengthening the muscles for their posture. In the sitting, you can see in the top middle picture where the child is sitting with a rounded back and a straight and a neutral spine. So you want to make sure when you see your child sitting in a rounded back that you want to correct it. And again, when you correct, you go down to the pelvis. You go down to the pelvis and correct that alignment in order for the rest of the spine to follow. When you're going to carry your baby, it's so much easier to carry them, you know, whether it's in a carrier, it's so much better that way, that's on your body, versus putting them in a car seat, in a stroller, because again, a lot of those baby carriers promote that rounded back posture. Okay. And then you can see for the backpack, if as much as possible, make it as light as possible so that they're not straining your back. Anytime you see your child arching back or leaning too far forward, that already tells you that the bag is too heavy for them. So we need to decrease it. With all the books that they have to carry, that's too much for them. And then if you're allowing them to have some technological, game time, make sure that they're sitting in a chair that's supportive and even a table, so then they're not really having that rounded posture that they have to sit, and then cause for them to develop bad posture.
Okay, so now we invite everyone to get their mats, and we're going to test those corrective exercises on ourselves. So I invite you to take your mats and we'll go through the different corrective exercises together. Okay, so we're going to turn off our cameras and you just have to listen to Hosanna's voice as she guides you through each one.
Okay, so we have about 8 exercises that we're gonna go through. The first one is deep breathing. Okay, so with deep breathing, I need you to sit on the floor with your legs kind of crossed and just relax and take a deep breath in through your nose and out through your mouth. So let's try it. Okay, ready? Let's go ahead and sit get back on your neutral spine, and let's take a deep breath in through your nose. 1, 2, 3, 4, 5, and out through your mouth. We'll do it one more time. In through your nose and out through your mouth. Okay, so now these are some of the corrective exercises that we can do so we can improve the flexibility, the strength, and the posture of your kids. Okay, the next exercise we're going to do is bridging. So if I can have you lay down on the floor and bend your feet or bend your knees with your feet closer to you. And then we're gonna lift our buttocks up in the air, okay? Ready? And then once we get up there, we'll just hold it for a count of 5. Okay, ready? So take a deep breath and let's go ahead and lift our bottom up. Hold, 1, 2, 3, 4, 5, and bring it down slowly. Let's do it one more time. Lift, 1, 2, 3, 4, 5, and down. The next exercise is the spinal twist. Okay, this one we're gonna work on some movement and flexibility in our pelvis area and our spine. So the way we do it is while we're laying down on our mat, bring your hips and knees up towards your chest in 90-degree position like a table. And then now we're gonna twist the legs down to one side, come back up and twist to the other side. And go ahead and position your arms out to the side for some stability. Okay, let's go ahead and try it. Legs up. And now we're gonna twist to the left. Ready? Go ahead and twist and hold. 1, 2, 3, 4, 5. And then go back to the center and twist to the right. And 1, 2, 3, 4, 5, and up. Let's do it again to the left. 1, 2, 3, 4, 5, and up. Then go to the right. 1, 2, 3, 4, 5, and back up to the center. Okay. And then our next exercise is the upward facing dog. So now I'm asking you guys to roll over to your tummy. Okay. Put your hands next to your shoulder, and we're gonna push up so then we can arch our back. And when you push all the way up, you want to make sure that your head is looking straight ahead. Okay, be mindful of your alignment as well. Okay, ready? We're gonna try this pushing up. Okay, ready? And push up and hold. 1, 2, 3, 4, 5, and down. And let's do it again. Push up. 1, 2, 3, 4, 5, and come back down. Okay. The next pose that we're gonna do is called the warrior pose. Okay, this one, I would like for you guys to go on half kneel position. And what you're gonna do is actually make sure that your knees, the front leg, your knee is just on top of your ankle. And we're gonna push a little bit forward without your knee going past your toes. And then your arms reaching straight, way up high, and lean forward. Okay, and we'll hold the position as well. Okay, let's go ahead and try this exercise. Go ahead and lean forward. Make sure your arms are reaching up high. Lean forward for a count of 5. 1, 2, 3, 4, 5, and back. And one more time. Let's lean forward. 1, 2, 3, 4, 5, and come back. The next exercise is the downward dog. Okay. So this one, from a standing position, we're gonna do an upside down V posture. So reach down, your hands reach down to the ground and move it forward and form a V shape and hold that position. Again, you want to make sure that your head is also straight in alignment with your spine. Okay, and hold the position for 5 count. Ready? Walk your hands forward. Align your head to the spine and hold. 1, 2, 3, 4, 5, and come back up. And we'll do it again. Come back down, walk your hands forward, align your head to your spine, and hold. 1, 2, 3, 4, 5, and up. Hope everybody's feeling good. Bodies are moving. The next exercise is the standing side bending. Okay, so we're standing up and we're gonna bend our body to the side with we're gonna bend our body to the right. So your right hand will be touching towards your feet and your left hand is reaching out to the side. Okay, so let's try going to the right. Legs standing apart. And let's go ahead and bend to the side. Your right hand touching your feet and your left hand reaching out to the side. And hold. 1, 2, 3, 4, 5, and come back up. Now let's go to the left side. Okay, bend to the left. Left hand touching your left foot, and then your right hand reaching out to the side. 1, 2, 3, 4, 5, and up. And then we have one more exercise to do. which is the tree pose. Okay, so we're gonna balance on our left leg. So you want to put your right foot against your knee and your arms reaching up with your palms meeting at the top center, and hold the position for 5 counts. Okay, so let's go ahead and try it. Right foot on your left knee, hands up, palms together, and hold for a count of 5. 1, 2, 3, 4, 5, and back down. Let's do it again. 1, 2, 3, 4, 5, and back down. So again, with any of these exercises, make sure you're being mindful with aligning your spine, so then we can make sure that we're putting all of them relatively in the correct position so that you have a good spinal alignment.
So thank you for that wonderful explanation, Hosanna. I mean, right now, I'd really be more mindful about my posture. While you were explaining, I was shifting on my seat, just fixing myself. So here on our slide are kids from the 1950s and our kids nowadays. So a lot has really changed, as you can see. And which is why, our bodies are our own homes. And, aligned structural support plays a really big role in our overall health. So these are our references for this particular lecture. And the floor is now open for questions. So Hosanna, we have our first question from Lester. So good morning, ma'am. Does baby wearing infants or toddlers promote good posture?
Yes. Hi, Lester. Yes, to answer your question, yes, the baby wearing infant, I mean, it's a lot better than putting them, in the carrier, like the car seat. Okay, so that would definitely help with that alignment. But again, as they get older, we also need to watch how they're sitting, because some of the baby carriers, you also have to watch certain types that does not promote uprights, to be able to sit more upright, especially once they're sitting up. So you just need to make sure you test it out with your baby, and that you can see that it's actually able to support them in a good posture.
I guess, Hosanna, when parents go to the mall with their kids, it's better to let them walk, right? Instead of carrying them or putting them on the strollers, like what our Filipino culture usually encourages.
Yes, definitely. Again, as I've stated before, our body is meant to move. So once your child is able to move and able to walk, let them walk, let them move around. I mean, you can also just hold their hand, but allow them to walk while holding your hand. That way, they're actually learning about gravity, how it affects their body, and at the same time, they're keeping active and keeping all those muscles moving. And learning how to hold their body up against gravity.
So here's another question. Are baby slings recommended?
To a certain age. I think once they're sitting up, you have to, again, there's a lot of baby carriers out there. So there's ones that are cloth when they're still an infant below 6 months, when they're not able to sit up yet. Those slings would be perfect to hold them, because at least the baby is close to you. You develop that bonding relationship. But once they're learning how to sit up, then you need to look and make sure that the slings that you're getting is actually supporting them, because there's some that you can configure to do the tying so that they're still able to sit up straight or have that better alignment. So what you need to look at when you do these is in the pelvis. The pelvis has to be in that neutral alignment, not too far back, not too far forward, but it's right there in the middle that would hold their pelvis in place so that they can actually have a neutral spine.
Okay, so we have another from Maria Raylene. How do we correct infants who have had bad posture, especially when seated, specifically an 8-month-old infant?
Okay, I think I just mentioned it a while ago. Let's start at the very foundation of it, which is at the pelvis. Make sure, I don't know if your baby is with you right now. If it is, go ahead and try it. It's actually find that pelvis in that neutral alignment. So you might have to kind of pull the bottom towards you and then tilt it to neutral, and you'll see your baby correct the alignment. Another way that you can do it is actually placing your, when you sit with your legs crossed, place your baby on top of your leg and then have the baby's leg right in front of, like a long sit position. Okay, so when the pelvis is higher than the feet, it kind of automatic, because of the physics in our body and the alignment, it will correct itself to be able to sit straight up.
All right, so a follow-up question from Maria Raylene. For shorter adults like her, is it more advisable to sit on the edge of a chair and resting the back?
Yes, I think not just for shorter adults, but actually anyone. Anytime you sit with a place where you can rest your back, you tend to just end up slouching because there's a device that's holding you up. So if you really want to be conscientious in getting a good posture, it's so much easier if you just allow your body to do it. So if sitting at the edge of the chair would be perfect, and then now you're holding your body up on your own. And that would promote good posture.
All right. So next, about sleeping. What is the best sleeping position for good posture?
Well, when it comes to sleeping, I think, for me, what you actually want is to get a good night's rest. So I'm not going to tell you, oh, I want you to sleep on your tummy because that's the best posture. But if your body doesn't like it, it doesn't feel comfortable, then you're not going to sleep good, then it defeats the purpose. Okay, sleeping has its own purpose. It's what your body needs to sleep in order for it to recover, to recuperate from the day's work, from your day. So I would recommend you sleep however you feel comfortable. What you need to do is, once you're awake, that's when you have to be mindful of your posture. Because again, when you're sleeping, that's when you're healing, you're recuperating. So we want that to happen.
Okay, that's really great advice, Hosanna. So we would like to invite everyone, for those of you who'd like to ask us more about posture, we have teletherapy sessions with our rehabilitation team. And for those of you who have been joining us since the very first week last April, we talk about all about movement, all about physical activity. So join us every Monday. We have our next episode on May 11, and it's all about obstacle courses. So are there any more questions?
I think on chat, there's one question from
That was the one about slings.
like, how do you prompt good? Oh, so we answered this one already. Children 5 years and below.
Yep.
You done? Okay.
We answered that already.
Okay.
Okay, so if there are no more questions, thank you again for joining us this morning. And do you have, oh, there's a one more question. We still have time. So will the recording be available? Yes, it will be posted on YouTube, so you feel free to share it. Thank you. So any last words, Hosanna?
My last word would be mindful of your posture. And as much as you can, start promoting good posture with your children. Because again, having good posture is a habit. So if we start them young, then we can continue doing it, for them to learn to have good posture. And as much as you can, limit time with technology. And if you do that, then tell them that they have to exercise first before they can use their devices, so that we can make sure that they're still moving and doing all that to keep their body healthy and strong.
Okay, thanks, Teacher Hosanna. So mind your posture. And with that, we say goodbye and see you again next Monday. Bye,
Bye.
T.